I'm Dr. Walter from SNS College of Physiotherapy. So today we are going to see another video that is about the lecturing of the passive movements. Yes. So in the past video you might have seen the myth-breaking concepts of the physiotherapy, and this video we are going to learn about the passive movements. As a physiotherapist, each and every physiotherapist should know about the passive movements. Yes, absolutely. From the college days, each and every student will be on the hands-on technique with the passive movements. When we ask a physiotherapy student whether you know the passive movements, all will shout and say, yes, I know the passive movements, because this topic is so much loved by the physiotherapy students. Now we are entering into the definition of the passive movements. This passive movement should be done by the therapist or by the external force. As we know, passive, active. So two types of movements which we have encountered in the life. Active we can do on our own. Passive movements will be done by the external force or by the physiotherapist. Consider I am doing this movement with the passive because I am holding this hand with this hand and I am helping out. And this is the active movement. By external force is nothing but nowadays in the new technologies we are having the computerized passive movement, that is a continuous passive movement machine for a shoulder, elbow, knee joint, and each and every joint are present in the market, and this is based upon the mechanical and the electrical support. Now going for the type, it is of two types, that is the physiological and the accessory, that is the glide, roll, and the sliding movements. What is physiological movements? When we do a passive movements, basics of the technique, like we need to the traction and gentle rhythmic movement of the particular joint. Yes, that is the positive way of doing the passive movements. When we do the traction associated with the flexion or extension for the particular joint, the physiological takes place inside. There is a circulation, there is a joint space, and in between this accessory movement, there is a rolling or gliding or sliding will happen. And these are the types of the passive movements. Now going for the effects. For each and every therapeutic exercises, we will have a positive effect. Okay, what is a positive effect? First is the ROM. What is ROM? There is a range of motion. Each and every joint has a particular range of motion. Okay, so our responsibility is to reach the maximum, that is a positive range of motion for each and every individual after occurring from any type of injury or contractures or any type of conditions. Range of motion achievement is the first and primary role in the passive movement. Second one is the stiffness. When we are relieving the stiffness, passive movements plays a vital role. For example, if we are giving a treatment for the adhesive capsulitis of the shoulder, the first initial stage of the passive movements plays a vital role here. The gentle traction and the movement of the flexion and extension, and this relieves the stiffness and the contractures. Next one is the pain relief. So what is pain relief? Absolutely, the relief of pain is 100% in the passive movement. The patient will feel a positive and comfortable effect in doing the passive movement. Circulation is the last one, and this circulation will be happening and the blood flow will be the best flowing in the area of the passive movement area. So a positive effect of the therapeutic treatment of the passive movements are displayed here. And next one is the indications and the contraindication. So for who we need to give and who we need not to give, and these conditions are the primary things which we need to give. That is, the indications are going for the unable to move, that is the adhesive capsulitis patients, and after injury, particularly after injury, when we are going for the passive movements, whether the patient cannot do the active movement. So this type of passive rhythmic movement will enhance the normal effect. Joint range, improvement of the range of motion will be working out in this indication, and we need to make a keen concept on the contraindication. And contraindication, that is the acute inflammation. If the area is inflamed, that is the inflammation techniques, Dolar, and all these things, there is redness and swelling, if there is present, we need to make a keen concept that we need to either less down or we need to stop the passive movement. And next one is the unhealed fracture, hairline crack. For example, if we doing the hairline crack, in that we are doing the passive movements, it will reach to the extended point of the aggressive fracture. We should not do in the unhealed fracture techniques. Next one is the severe pain. If the patient is having a shoulder pain and severe, like if I am not able to lift my hand and I am going as a physiotherapist going to do the passive movements, it will not work out here. We need to first reduce the pain, and next part is the passive movements. Last stage is the surgical fixation. Surgical fixation, as we have done many type of post-operative success treatment in the physiotherapy. Okay, so after the surgical fixation, we need to give some space for the fixators to fix inside the bone, and the muscle should be covered. And after that only the implementation of the passive movements will be taking out here. And coming to the conclusion, passive movements as whole plays a vital role in the physiotherapy. As in the start of the video, I told each and every students along with the patients will enjoy this treatment. And thank you for watching this video. We'll meet on to the next video with another content. Thank you.